Okay, Liz, do we have everyone in the room?
Yep.
All
Okay.
right. Hi, everyone. My name is Dimple Patel. I am a policy director with Casey Family Programs, and I am a backbone team member for this initiative. I wanted to thank you all for joining us today to learn more about what's happening in this space around the country. This is part of our educational series that's part of the Massachusetts Initiative to Reduce Neglect that the Children's Trust is leading. And this webinar really stemmed from the energy and momentum from our last convening in December, where so many of you had expressed an interest in learning more about examples from across the country. So without further ado, I want to introduce you to our wonderful speakers today. Christine Calpin, who is the Managing Director for Public Policy at Casey Family Programs, and Krista Thomas, who is a Senior Policy Fellow at Chapin Hall. We want this to be an informal learning opportunity, so please enter your questions as they come to you in the chat, and we can stop along the presentations to answer them. Also, a recording of this webinar, along with the PDF of today's PowerPoints, will be uploaded to the Children's Trust website in case anyone couldn't be here today or you'd like to go back and access those notes. So without further ado, I'm going to turn it over to Christine, who is going to get us started with a little bit of national landscape and framing about why really thinking about community pathways and upstream prevention is important. Christine, I will turn it over to you.
Thanks, Dimple. It's a pleasure to be with you all today. I'm thrilled to have the opportunity to join you in conversation and to be here with my dear friend and colleague, Krista Thomas. So we are very excited to be a part of this conversation. Give me a moment here. I'm going to share some slides that I'm going to walk through here. With my goal being, as Dimple mentioned, to spend just a few minutes prior to turning it to Krista talking a little bit from a national landscape about the focus and the engagement that's happened around really trying to reduce unnecessary child welfare reports, and looking forward to your questions and conversation. Let me just, for those of you who may not be familiar with Casey Family Programs, we are a national foundation headquartered in Seattle, Washington. We have a cousin in Annie E. Casey, and are very grateful for our long history and the experience we have in this system. We are the nation's largest operating foundation, and our focus is exclusively in the space of foster care with a goal of safely reducing the need for foster care throughout this country. We have partnerships and engagements in all 50 states, the District of Columbia. We are in Puerto Rico and the Virgin Islands, and we also have direct agreements with a number of tribal nations. And the idea within our strategy is for us to bring our resources alongside those closest to the work and engagement to really inform and try to be a partner with them in that space. In my time, I'm going to provide just a quick recap of some of the research-informed outcome areas that we have really centered our work on, and I think provide some context to the conversation today. I'm going to talk at a very high level around the national data context that I think has really centered the conversation we're currently having on who are the kids coming into care and who are families being reported to the system. I want to just talk very at a high level about some of the evolution of federal policy in this space. I think it's helpful to have a little bit of a sense of the partnership that the states have with the federal government. As many of you know, states have the primary responsibility for their systems, and a lot of this is a partnership with the federal government. And at the same time, the direction and resources that are provided, we know do set a course and help to really engage in this space. And then just a few questions to open us up and then kick things over to Krista. The points here, I think, have really guided and have, I hope, really provide a high-level summary of the framing as we try to begin to think about the focus we have on foster care, but from a lens, again, of taking a step back and recognizing that ultimately the outcome we're trying to influence is the well-being of a child and their family. So what the research has clearly shown us is that we know that in order to support a family and increase child well-being, intervening as early as possible is critical. That the sooner we can consider and think about the most effective way and the most supportive way to engage with the child and the family, the better off everyone will be. The research has really pointed to evidence-based practices that show that we can really support and keep some vulnerable children safe with their families at home if we're really intentional and thoughtful about wrapping appropriate resources and services around the families. This is an area where the research is really being clear about the opportunities we have for those children who we may have otherwise thought foster care was appropriate to really consider and think about the reality that we have a slew of services and areas that we should be leaning into instead. And why is that? It's because we know that for a very small number of children, it may be important for their immediate safety to think about foster care, but removing a child from their family and from their home is traumatic. It creates challenges, it creates a lot of emotional trauma. And so understanding the impact of this policy is so critical and helping us to make sure that if we know better, can we do better? And what does that mean for how we're engaging and supporting families and children these days? And so we spend a lot of time looking at this triangle as we try to think about the population that we talk most about. This is from 2003, I'm sorry, not 2003, 2023, excuse me, the Child Maltreatment Report. And if you'll see at the top level, in that year, 7.8 million children were involved in referrals where someone alleged that maltreatment was occurring. We use this triangle because it shows the way the population becomes essentially down to a point where, in a universe where we've started with 7.8 million children, ultimately 145,000 children entered foster care, which means that the overwhelming majority of these families and children are not going to see foster care as their placement. What we want to make sure we're talking about is a couple of things that the data show here. So first and foremost, all of these children involved in referrals means that a report has been made. Someone has picked up the phone. Someone has put this family in front of Child Protective Services, which is an important step. And what that means is that for a little less than half of them, CPS then decided this warrants an investigation. We should go out, we should engage with the family, we need to investigate, we need to assess. And we need to decide if we think this meets the evidence for abuse or neglect in our state. The data here is also though very clear that of the CPS investigations we do, most of them result in unsubstantiated findings. What does it mean to be unsubstantiated? It means that they did not find enough evidence to show that abuse or neglect occurred consistent with the state law. It doesn't mean the family may not be in need of some help, right? It means that we don't need to continue down a path of exploring whether or not there is abuse or neglect. It means we can close the case. And in some instances, they do. They simply will close a case and walk away. I think what we're beginning to want to consider is if we know from the research that intervening with this family as early as possible is so critical, are we missing a moment there to consider how and in what ways could we engage with that family differently? How might we be a resource to that family and assist them in whatever it is that may have brought them to a call or to a report? What's exciting about that, and as Dimple outlined, engage very much in the policy work, is that we really have seen an evolution of policy, particularly at the federal level. And I think a lot of this has been following where the states are going. I think we spent many decades looking at a reactive model, a model that was just focused on out-of-home placement. a model where we were highly reliant on institutional care. That funding in terms of the federal government support to states was very restrictive. It was only supporting removals. We were only engaging with the state once they decided to place a child in foster care. So if you're talking about 7.8 million referrals down to 145,000 kids in foster care, that's the vast majority of families and children that for which federal support was not really being mindful of how we could help. And it was very much it was just a crisis-based intervention strategy. We were intervening when there was crisis. So the conversation today, and I think what Krista is really going to lean into, is a lot of the leadership and the work that Chapin Hall also has been doing and looking at what are the proactive ways that states are really thinking about how they can engage with families. How can we rethink where we're meeting them, how we're identifying and how we're engaging with them. And that allows us to do a number of things. It allows us to think about how we can focus and fund in-home services. How can we bring these resources to them? It allows us to follow the research that shows that kinship care really is the best option for any child who may need some support or removal. So how do we really lean into emphasizing that? Um, there is just a lot of flexibility in prevention funding alongside obviously the prevention funding that's available to states now with prevention through Family First. We can talk a little bit about that, but the array of programs that states are really considering and thinking about to support prevention and think about supporting families is exciting. And I think it allows us to begin thinking about what a continuous family support service model look like, and what is the role of the community and really being at the forefront of that? And how can we be sure that the government resources get to the communities to do that? And I think that's what we're going to learn a little bit more about from Krista today. So before I turn it over to her, I think a few of the questions I hope that you'll just think through and consider as worth learning and considering is, particularly for Massachusetts and others, why are children coming to the attention of child protection? What is leading to so many of the reports and the referrals? Where are those referrals coming from? And how can we use that information to understand what it might look like to be strategic and intentional about resources for that population? What are some of the ways we can support families and really provide needed resources for services that will keep children safely with their families? What are we learning from community partners about what works? How can we provide the resources? How do we bring that information forward? What can we learn from other jurisdictions like the ones that Krista's going to uplift today? Um, are families able to access the intervention services and supports they need when they are in crisis? Can they get the necessary resources to really help in whatever way we possibly can prevent that removal? And how do we make sure the systems are doing all we can to do that? And again, too, you've heard me talk a lot about it, but there really is so much energy in trying to think about how do we engage community, how do we engage partners, and how do they work alongside agencies in being sure that we're doing all we can to promote child safety. Um, so with that, I'm going to turn it over to Krista. I'll be here very happy to answer any questions. And again, just want to thank you all for the invitation to be here.
Great. Thanks, Christine. That was a fantastic opening, and good afternoon to everybody. I had to look at the clock to see what time it was. Good afternoon to everybody, and thank you so much for having us today for this discussion. I'm Krista Thomas. I'm a senior policy fellow at Chapin Hall, and I have been spending a lot of time over the last decade and beyond working with child welfare systems on transformation strategies, and since the passage of Family First, really focusing on investing in prevention services, thinking about how to expand our prevention services more upstream and really reorient more toward a child and family well-being system that helps people get what they want when they need it and get the appropriate response. I'm going to show my screen. Let me know if we're there. Do you see my Outlook calendar or do you see a PowerPoint?
We see the PowerPoint.
Okay, perfect. That's way better than my Outlook calendar. So I am with Chapin Hall. We are a public policy research institution that is focused on improving well-being for children, families, and communities facing adversity. We do a lot of work in child welfare, in community capacity building, juvenile justice, ending youth homelessness, and increasingly taking a multi-system response to meeting family needs. And we're focused really on trying to identify and advance evidence-informed policies and programs that are best set up to improve outcomes for kids and families. I have a lot of content today. We may or may not get through all of it. I really want to keep it as a dialogue because some of these concepts or approaches might be new. And so if we need to take time to go in and explain things more, I'd like to keep this open as a dialogue. Raise your hand, ask a question. We'll get through as much as we can. And if we need to do any kind of follow-up, happy to do that and continue and keep the conversation going. So, in 2018, the Family First Prevention Services Act passed, and it really started to shift the national mandate and national dialogue around prevention. While the legislation itself is really written in more of the traditional child welfare paradigm and focused specifically on evidence-based programs in the areas of substance use, mental health, and in-home parent capacity building, it also really got people thinking about prevention in a different way. Not only groundbreaking and opening up Title IV-E to prevention services, which had never happened previously, which is objectively important. The legislation also has an inherent amount of flexibility that has encouraged folks to think about how do you work within that flexibility and leverage both the legislation and the resources to invest more in prevention, to go upstream and start thinking about what a more robust prevention services continuum could look like. To that end, I'm going to talk about 3 strategies. These are not mutually exclusive strategies. They are interrelated. They're part of the broader prevention continuum conversation. But I'm going to start with talking about what we call community pathways to prevention in the Title IV-E context, or how do we get families access to prevention services, leveraging Title IV as a lever for that. Also, a different national effort called Opt-in, or the Opportunities for Prevention and Transformation Initiative, sponsored by the Doris Duke Foundation, which is also kind of focusing on some of these upstream efforts, as well as a few jurisdictional examples around warm lines. And some of these are all happening in the same jurisdiction. And so they're separate, but they are all interrelated. If questions are popping up, I can't see everything. So please somebody just jump in if anybody wants to stop me at any point in time. So this flowchart actually goes right back to the same data source that was in Christine's inverted triangle. And I wanted to start this conversation. I know it's small and we can go into anything that you want to see more deeply. What I'm going for is the high level takeaways, which is that, and this is using the 2023 Child Maltreatment Report, that we've got over 7 million children that are called into CPS hotlines every year. And of those 7.5 million, 7.5 million.
Hey, Krista.
Children, yes.
I'm just going to pause you for a second. Your Teams chats are popping up. I don't know if you know, but if you want to mute that, it might be, I would suggest you mute that. Thanks.
Thank you.
Yeah,
thank you. Let me know, and I will move the screens if that happens again. Okay, I was a little distracted by that. That's why, so I appreciate you saying that.
I wasn't sure if you could see them or not, so I just wanted to let you know. So,
well, I'm looking at you, I'm looking at the slides and trying not to look at that. And so I'm doing my best to navigate all that. Okay, so we've got, about, just under 4.4 million calls came into the hotline that corresponded to just under 7.8 million kids. And more than 6 million of those kids didn't get any services at all. Something happened that indicated to somebody that there might be an issue with the family, there might be some opportunities to support the family, but our system is not set up, as it's generally to get families that could benefit from some kind of engagement and intervention connected to services. So we have, and I'm just going to look closely, forgive me for appearing at this a little bit, of those 7.8 million kids, over half of them were screened out. That is an opportunity to think about where we might engage and support families. If we work down this trail, of the 3 million kids that received either an investigation or alternative response, About 18% of those, or 18% were confirmed, victims of maltreatment. And of those, 45% of them didn't receive any services at all, or specifically 19% received foster care services, and 36% of those received non-foster care services. Of the folks that were confirmed to be non-victims, 77% of those didn't receive any services. And at the end of the day, we've got a whole lot of families and a whole lot of kids that are interfacing with child welfare that have something suggests that there could be an opportunity for engagement and support. And more than 6 million of them aren't receiving anything at all. And we think about the repeat involvement of the years over the trajectories of families. Is this offering opportunities to engage and intervene in ways that we haven't been doing to date? Also wanted to kind of structure
Krista, I
this
had a
year.
quick question that was in the
Please.
chat. Abram had a question around the ideal percentage range. You may not have the answer to this, and Christine, feel free to jump in as well if you do. What's the ideal, or what would you say would be the ideal range for screened in or post-response services? Is there an appropriate way to quantify the goal of fewer unnecessary reports?
I saw that question, Abram, and it was right when I was getting ready to speak, and I was like half in the middle of writing. I don't know, to me that it makes sense to think about us. Gosh, why are you stop that? That it really makes sense to think about it from a specific quantification or numbers perspective, but we want to think about designing a system that responds to families in the way that makes most sense to them. Are families getting directed to CPS that are appropriately supposed to be there? Are we creating mechanisms to services and supports that address the circumstances that are driving families there, and not creating systems that send people to CPS where that is not the right response because we haven't developed the right mechanism to get them to the types of supports that they need. And what that number is going to depend, right? We're living in a constantly dynamic environment. We have changes in, public policy and public benefits that are available, different, geographic or societal or state context. And so what families need, they may evolve over time, but I think it's more about designing, a child and family well-being system that is set up to respond appropriately rather than thinking about, hey, 10% of these should be child welfare, 35% should get, X. I'm not sure that that's the most helpful way to think about the transformation effort.
And
Does
I
anybody
would
know
just,
how to turn off that Teams? I closed it.
Krista, just while you're troubleshooting, what I was going to just offer too as well, and to the other part about quantifying the goal of fewer unnecessary reports. A way to consider and look at this is that across the nation and in states, there tend to be three categories of reporters that largely are at the highest level in terms of bringing children or families to CPS, and that's teachers, the medical field, and law enforcement. And though it varies within those populations as to the extent to which those reports end up being substantiated. So some of this might also be looking at by the reporting category, like among the police, for example, do their reports tend to be substantiated or not? And if they're not, then why are they reporting to CPS and what could those families need? And so there may also be, building on what Krista said, a way to look at, if we look at where our highest reporters are, why are they reporting and what's missing? And there could be a very strong reason for an issue that needs to be reported. So to Chris's point, it's less about a number and more about what's the nature of why CPS is the first place they're going. And is that where we want them going? Or do we want that report? Can we handle that report in a better way? And if so, how do we get there? So, and I think that's the conversation to be having. So thanks, Krista.
Great. And I did solve the Teams issue, so I think we're all good to go. So before getting into more of the details around the community pathways and some of these other upstream prevention approaches, I kind of wanted to ground us in how are we using our resources to fund child welfare? What does Title IV look like right now? And to really lift up how much opportunity that we have to optimize the opportunities that 4E brings. And I'm using two different data sources, which is why the left side says 2024 and the right side says 2023, but the message is overall the same. If you look at our federal fiscal year 2024 claiming data, We spent just under $4.8 billion in foster care, and just under that for Title IV supported adoption and guardianship assistance, or services and supports and programs after families have suffered the trauma of family separation and have gone into foster care. We spent in that same year $182 million on Title IV prevention services. So, 6 years past Family First implementation, only 1.6% of the total federal expenditures for Title IV were directed toward prevention. That suggests that we have a lot of work to do to try to flip that ratio so that we're investing more in preventing maltreatment and preventing family separation through foster care, and that we've got a lot of opportunity to improve that. If you look at the graph on the right, it's not all bad. We are getting better, and you can see steady improvement. And looking at the federal or the fiscal year 2023 data, we spent 172.5 million, so 10 million less, than the year that followed, corresponding to about 18,324 kids. So we are not yet fully tapping into this, funding lever, and there are opportunities to think about how might we really think about reaching more families and prevention services through Title 40. So we'll start the conversation around community pathways in the context of 40. What are we talking about when we say community pathways? What does that even mean? Well, when we use that word, we operationalize it as any avenue that families can use to access Title IV funded prevention services outside of the traditional child welfare paradigm and case management context. So like when you think about, how families receive services through child welfare, community pathways provides access to those prevention services, but outside of that traditional service delivery context. In that case, who's doing it? Who's providing the service delivery? Who's doing case management? There's a tremendous amount of flexibility, a lot of different options, and jurisdictions are thinking about this, very differently. Could be contracted community-based agencies like family resource centers or community action agencies, where that's the place where families are going to get assessment and service planning and connection to services. Could be administering Title IV directly through specific evidence-based services providers, with home visitors being one of the more common partnerships that jurisdictions are lifting up. We've also got a number of jurisdictions that are thinking about other partnerships, Title IV agreements with other public agencies who might be interfacing with many of the families that are also interfacing or are at risk of interfacing with child welfare, like departments of ending homelessness or behavioral health or public assistance. And I'll talk about a couple of those examples later on this morning. And as we think about this, it's also lift up that we're talking about Title IV, but not often Title IV alone, but alongside different funding sources that we bring together to try to create a more robust, kind of multi-system, holistic, or upstream approach to develop these preventive services continuum. I can see that there are chats coming in, but I can't see what the chats are. So is there anything we should stop and address before I get going?
I think there are questions around, the strategies around mandated reporting, where I think it might come up as we talk about warm lines.
Okay, awesome. Dimple, keep me honest, and then let's stop me when we need to. And if you know that I'm going to get to it, we can certainly do that. Thank you. So this visual, this mountain, is meant to illustrate who are the different types of families that we're talking about that jurisdictions are aiming to serve through community pathways. And so focusing on the different groups on the mountain, starting from the top. Could be families with no direct child welfare system involvement that may meet the candidacy definition or the overall service population that families have or that jurisdictions have decided to serve through Family First. So families that meet some of those candidacy characteristics, but they have not yet interfaced with CPS and trying to serve them through a community pathway to prevent that involvement. Could be families that have been referred to CPS, but were screened out, and who screened out and then subsequently connected to community-based resources. Could be families that were referred to CPS, did get screened in, did receive an investigation, and whether it was substantiated or not substantiated, that was determined that there wasn't ongoing risk. So the child welfare case closed, but there was recognition, that the family could benefit from some prevention services. So after that closure, then connected to a community pathway. Could also be families that are transitioning to prevention services after having an in-home services case. So you went through that, you went through the investigation, there was some court-ordered in-home services. We've got, the safety issues resolved to the point that a formal child welfare case doesn't need to be open anymore, but the family may still benefit from services and supports. You could close that child welfare case and then begin serving the family in the community. And then lastly, families seeking post-permanency supports. I think we tend to think about this continuum as a kind of a straight line. I tend to think of it more as a circle. So you may have a family that has, had a child welfare experience, experienced a family separation, and then achieved permanency through reunification or guardianship or what have you. So the child welfare case is closed, permanency is achieved, but maybe there still are some conditions and circumstances where the family would benefit from some additional services. Then they could also read these or receive these prevention services to then hopefully prevent subsequent return into the child welfare system. This whole idea has gotten an awful lot of traction nationally. I think by last count, we have 24 states that are at some developmental stage of a community pathway and have signaled or described it in their approved Title IV prevention plans. And these states are at some stage of either conceptualizing, kind of building out, defining the specifics of their community pathway. There's another cohort that is in the installation process and really starting to get their system ready for delivering services in this way. And we've also got a number of states that have moved on to, initial implementation. And so I show you this map to show there's really an idea that's getting a lot of traction as we recognize that we really don't have the prevention services infrastructure that we need to meet all the families that would benefit from services, and that there's an opportunity to take advantage of Title IV as one funding stream and one mechanism to try to help fill that gap. So what's good about this idea? What are some of the benefits of community pathways that might encourage us to think about it? Well, it gives us an opportunity to address those gaps, a pretty significant funding stream that can be really useful for enhancing the existing prevention service delivery continuum. We've got a huge workforce crisis. Many states, many jurisdictions, localities around the country are really struggling to engage and sustain a workforce. And this idea of community pathways gives us an opportunity to reconceptualize what could that prevention services workforce look like, and to think innovatively about creating, pathways to, prevention services, jobs and opportunities in communities with community leaders, with peer parents, with lived experts. So it's an opportunity in that sense. The Title IV funding is available not only for service provision, but also for administrative costs, which can be really helpful for building up the community-based prevention services infrastructure and creating more opportunities for families to access services in places that they know and trust that are very close to where they live. And this can be a mechanism for trying to build up that infrastructure. And by extension, strengthening community capacity to enhance family stability and prevent child welfare system involvement. This next one is is a tricky one, and it often warrants a lot of discussion and will, be something to think about today and probably for future conversation. But it helps us rethink about the role of the child welfare agency and to transition it from being the primary service delivery lead to so it's more of a funder or a facilitator of the services. And because we know many families are receiving services in multiple places, and that to really address holistically the circumstances, it really promotes collaboration across family serving systems and helps us really think about prevention services in a more integrated and holistic manner.
Krista, Jen actually had a question around, are you finding that if and when the child welfare agencies in the state hold the funding, that it means families don't want to engage with the prevention services offered through 4E? How do states navigate this? It's the idea of DCF being the person doing the prevention work.
Yeah.
Do you want to share a little bit about that?
Sure. I mean, that is a really important inquiry and one that jurisdictions are grappling with as they're building out these prevention services continuums. What jurisdictions are doing, and we've got a number of really strong examples, are embodying a really strong spirit of co-design and bringing community leaders and families and lived experts to the table in the design of what this looks like. And there's a number of jurisdictions that have really embraced the spirit of co-design and transparency around this is what we're doing, this is where the money's coming from, this is what it's going to look like, and trying to have it to be an integrous process, to be a transparent process, and to be designed in partnership with communities and with families to try to address what is a very natural concern about whether and then to make sure that that's transparent and available to families if they're making the decision whether or not to engage. So, like, is it a valid question? Absolutely. Is it something that every state or jurisdiction or locality is dealing with? Absolutely. And the mechanisms for addressing some of those concerns really are in partnership with lived experts and advocates and and other partners to try to design a system that's going to work for the families that it's mostly intended to impact. Does that help?
Yes, Jen, I don't know if you had other questions.
No, that's great. Thanks, Krista.
And it's also a good CQI question too, right? And so we'll get one of the recommendations or things to really think about when moving in this direction is also having really strong kind of like CQI and evaluation mechanisms. I'm kind of jumping ahead and getting a little bit more into the weeds. And to think about that not only for the family first evidence-based programs themselves, but for this whole shebang, and to be thinking about identification of families, engagement of families, participation, who's staying in services, who's not, and to have mechanisms for trying to actually systematically understand whether we're reaching the families that we want, if not, why not, and to be thinking about how to develop data collection mechanisms and engagement protocols so that we're kind of tapping into that and paying attention to that throughout the design and implementation process. Okay, so shifting to challenges and tensions, right? There's a lot to think about, very much aligned with Jen's question. And jurisdictions got to think about, in partnership with families and their partners and community partners, if this is the right strategy, if it's going to work for your infrastructure, if it's going to work for your families, if it's going to work for all of y'all, that make up the network, the prevention network in any given community. Offers a lot of the 4E offers a lot of flexibilities. You got to balance that alongside, what are the legislative requirements for implementing these programs and what are the responsibilities that need to be upheld and the Title 4E agency role. And we'll go into that a little bit. If we're going to be extending prevention services to more families than have previously received them, there is a natural expansion of surveillance that would accompany getting more families into these types of prevention services. How do we manage that so that this expansion of prevention services doesn't result in unnecessary child welfare involvement or involvement that wouldn't have occurred, absent in the expansion of the prevention services through this mechanism? In order to situate these types of services in community-based organizations, we need to have the infrastructure to administer them. And so do we have the infrastructure? Do we have the workforce? Do we have the capacity to provide these prevention services in other places? And do we have the capacity to build it? Do we have the service array available that is going to align with what families most need and want? We can have a whole conversation about the EBPs that are on the clearinghouse and alignment, and that's a whole other conversation. And so if we're going this mechanism, do we have programs available that meet the needs of families that we're seeing? Are there enough to address holistically, what's driving them to the front door of child welfare? And are we, going to have a service array that families are going to want to engage in? And sort of related to that point, family first services focus on the EBPs. Families often need other types of services and supports beyond that, addressing poverty-related stressors, housing, domestic violence, or other needs that don't fall neatly in the family first bucket. Do we have the ability to complement, EBPs with a broader range of services and supports that would address, families' holistic conditions? and the ability to braid funding streams to get us there. 4E is one piece, it's an important piece, but it's not the whole piece. And do we have the capacity to identify and braid and blend other funding streams to be able to sustain a prevention services continuum in this way? So going back to the role of the child welfare agency, what do they do? What's their role? What's the role of the of community-based partners or other folks that might be administering the Title 4A community pathways? Community partners can absolutely identify families that may meet the the jurisdiction's candidacy definition, so they can identify and engage families that may benefit from these programs. The actual Title 4E eligibility determination must be performed by the Title 4E agency. That's a fundamental requirement to the 4E agency. So partners can identify and engage. The actual eligibility determination happens by the child welfare agency. All of the administrative elements, developing and monitoring prevention plans, assessing needs, identifying and referring and connecting families to services, conducting ongoing risk and safety assessments, actually providing EBPs, all of that can be contracted out. So none of that has to happen, by the child welfare agency. Going back to that CQI conversation that we were talking about, that is that's a partnership. Is our prevention services pathway as well as the EBPs themselves being implemented with fidelity, with quality, having the intended impact on families. That's a partnership between the child welfare agency and the and community partners. And then there are Title 4E data elements that must be reported to the Children's Bureau on a regular basis that would fall in the responsibility of the Title 4E agency. But generating the required data, is a partnership, but the actual reporting requirements would sit with the state child welfare agency. Oh, there's a lot to consider if you am thinking about whether to go down this path. There's like thinking about the requirements, thinking about the capacity and infrastructure to pull this off. Is it feasible? But also, like, is this an opportunity that makes sense for for state priorities, for your priorities, and what is going to be most beneficial for the for families that are at risk of child welfare system involvement or maltreatment? Do we have the right types of partnership and partner engagement and lived expert engagement? And there's a lot to think through, and this is we can continue to go into any one of these issues as you start to explore whether or not this is a good fit. Okay, let me pause there because now I'm going to jump into how this is being operationalized in other jurisdictions. But before doing that, I'd love to open up the floor if there's any high-level questions, because I'm really just kind of staying at the surface of a really detailed conversation. Are we all good? Can we keep on trucking?
I think we're good. I'm not seeing questions in the chat.
All right, awesome. Thank you. Okay, so this slide corresponds to that mountain visual from a couple of minutes ago. I just want to kind of reorient us to who are the families, where are they on the child welfare continuum that jurisdictions are focusing on so far through this community pathway opportunity. And you'll see that these boxes are not at all mutually exclusive, and some jurisdictions have more expansive community pathways and others are a bit more targeted. As you can see in the first box, there's a number of jurisdictions that are looking for opportunities to reach families that have been identified as being at risk for child welfare system involvement, but haven't walked through the front door yet, and how to intercept and get them connected to services before that hotline call occurs. There's a number that are looking to serve families after they have come through the front door of CPS but haven't progressed any further. They got screened out or they were investigated and the case was closed. There was no safety need to keep a formal child welfare case open, but there is opportunity to serve the family and address conditions that may keep them at risk. So there's a number of states that are focusing on that point of the continuum. And then others that have progressed a little further in the child welfare system, whether they have received court-ordered in-home services that have closed, but there's still a service need, or have in fact experienced a separation, have achieved permanency, and we're trying to sustain that permanency and prevent re-involvement. Opportunity to keep families connected there. So there's lots of options and lots of ways to think about it based on what are the needs of your target population, where do you see the opportunity to make the most impact. I'll start with Arizona as one example. There's a whole lot. I've only picked a couple. So if people are interested in any states in particular or want to go deeper on a particular type of pathway, we can certainly do that. I've just picked out a couple, given the time that we have together today. And I'm going to start with Arizona. They're an interesting state that is grounding their community pathway around their home visiting partnerships. So their population, they're focusing on kids that have not had previous child welfare system involvement, that are eligible for the home visiting programs of Healthy Families, Nurse Family Partnerships, and Parents as Teachers, as well as substance exposed newborns. And so these home visiting providers are the entity that's charged with administering all of the Family First administrative elements, the assessment, the child specific prevention plan, the ongoing risk and safety monitoring, all that is situated within the home visitors themselves. They communicate whatever information the child welfare agency needs, but the home visitors are the folks that are providing the services, gives them an opportunity to extend the reach of the home visiting programs, and that is the mechanism that Arizona is using. Colorado is focusing on both families that have not experienced child welfare involvement, as well as families that are beyond our post-child welfare system involvement. As you can see from the bullets, it's a pretty wide candidacy definition, and they are orienting their community pathway right now specifically around safe care. This slide shows all of the different EBPs that are in the state's approved Title IV prevention plan. The red box, and you'll see this in a couple of other states, is the EBP that's approved for community pathway specifically, though the idea is to expand beyond safe care into a few of these other EBPs. What's interesting about that is that safe care is a voluntary service that's implemented statewide in Colorado. I believe by definition, it can't be delivered to families that have court-involved open child welfare cases. And it's an important part of the primary and secondary prevention in Colorado's continuum of services. So it's able to leverage 4E to strengthen that service array that goes a little bit further upstream. So that's where they're focusing and hopefully expanding from there. DC was hot out the gate. They were the first jurisdiction to have an approved plan. They were at the forefront of the community pathway conversation, and they have an existing infrastructure of Healthy Families, Thriving Communities collaboratives, or the collaboratives, which function a lot like family resource centers that provided a great infrastructure to tap into. They're focusing both on families that are post-child welfare involved, and you can see that through some of those bullets that are up top. And I also want to talk about some of this innovation that they've got for the families that have not been child welfare involved, that they're serving through their partnership with the DHS Virginia Williams Family Resource Center, which is actually a public department for ending homelessness, and identifying families that are eligible for homeless services as candidates for prevention services, given everything that we know about housing insecurity as a key driver of child welfare system involvement. So that's a really interesting new partnership. DC's conceptualizes they use this front yard, front porch, front door language to understand who are the families that they're trying to serve, who they can see that, that's at risk, that they know has potential and likelihood for system involvement, and they're reaching those front yard families through this homelessness partnership. Families that are on the front porch, those are the families that they're serving through the community collaboratives, as well as, families that are a little bit more at their front door, focusing on the children of pregnant or parenting youth in care, and wanting to make sure that those families are supported and receiving the prevention services that they need. The two EBPs approved in DC's plan are for community pathways, are motivational interviewing and parents as teachers. This motivational interviewing is idea is its own conversation. Motivational interviewing is a well-supported, evidence-based program that was originally designed to serve families experiencing challenges with substance use. What DC and now a few other states have done has gotten motivational interviewing approved as a cross-cutting case management service. This means that if you institute if you institute motivational interviewing into the prevention workforce that's serving families, then every family that's engaging is receiving an evidence-based practice, and it has a significant benefit for both improving the quality of casework practice and the service experience of families and their relationship with their prevention worker. And it also has really significant financial benefits because it signifies that every family that's engaging with a prevention worker that's doing motivational interviewing is receiving an evidence-based practice. And so it's a really important financial strategy. And that I think we could spend all day talking about the benefits and the opportunities there. So DC, what they're currently implementing are these collaborative partnerships where families go through the hotline, they have an investigation, they may receive in-home services. The formal CFSA or the Child Welfare Agency case is closed, and then families continue receiving services through the community collaboratives who administer the prevention plans and get families connected to the EBPs that make sense for them. This homelessness partnership is in its pilot phase and is really important for thinking about how more of this cross-system approach and engaging families that are experiencing or at risk of experiencing homelessness that are eligible for homeless services. It is the Virginia Williams Family Resource folks that are charged with doing the intake, doing the assessment. They send the information to CFSA that they need to confirm eligibility, but families receive their connection to the housing services that they may need, and additional prevention services by a prevention worker that's trained in MI, but all of that is happening outside the context of the child welfare system. And it's those DHS staff that are charged with working with the family and administering the prevention plan. So very interesting, public partnership in this sense. Michigan is another one that I'm lifting up here because of their pilot related to their future 211 implementation. They are, again, like others, serving both non-child welfare involved and post-child welfare involved families. And it's this 211 arm that I want to focus on today. And I'm looking at the time, so I'm going to skip over some of this. They've got a lot of services that are in their plan. All of the programs that are in Burgundy are the ones that are approved for administration through a community pathway. Michigan, like DC, has motivational interviewing approved as a cross-cutting case management service. So that is a cornerstone within their overall community pathway strategy. Families without child welfare system involvement, similar to Arizona and others, can access voluntary home visiting services, including Family Spirit for their tribal population, without any ongoing child welfare system involvement. So this case really looks, a lot like what we talked about in Arizona. But this 211 opportunity is currently in its pilot phase. How this one works is a family gets referred to the hotline. The family screened out, so they don't make sense to continue down the child welfare path, but they do meet the criteria for ongoing prevention services in Michigan's candidacy definition. They're identified there. The 211 community resource advisor follows up with the family and then offers voluntary services. See how that goes based on the family's need. They provide the referral to the Family First EBP that might make sense for them. If the family accepts the referral, the 211 follows up with the family and they get connected to the EBPs in the community, and all of this happens outside the formal child welfare system and stays out in the community with the partnership between 211 and the providers. They're still working through this. It's still being piloted. But I just want to connecting it to that warm line conversation that we're going to continue a little later this morning. There's a resource that I've got at the end of this deck. All of you guys will get the slides and these resources that goes deeper into this conversation. But as I'm imagining, you guys are swimming in these details, in the possibilities, in the concerns, in the opportunity, and all the what ifs and what abouts. There are a ton of considerations for any jurisdiction to really explore in whether or not to move forward with leveraging 4E for this opportunity. All these boxes just represent a lot of the domains that we want to be thinking about. And we can go into any more of those later. And there's a resource that kind of unpacks each of these things and questions that you might want to ask yourself and partners if going down this pathway. I'm about ready to shift to opt-in, but let me pause there because I just unloaded a lot of information on y'all. And I think I'm actually going to stop sharing my screen so I can see you. Because I'm imagining you might be looking like you just got this onslaught of information.
We had a couple of questions come through, but I do think the opt-in for families is something that everyone here is wanting to hear about because I think it aligns one-to-one with, I think, some of the work we've been discussing. So I don't want to take up too much time there. Rachel had a question around candidacy for the prevention plans for states that have chosen a definition of candidate that includes families prior to agency involvement. What are they submitting to ACF as the families prevention plan as part of their claim for the dollars? And are the community agencies the ones developing those plans for the families?
Okay, let me
And that might have to be an off. We need to answer that offline just to get the opt-in content in.
Yeah, I see that. Let me just take for states that have chosen a candidate. Okay, what are they submitting to ACF as the family's prevention plan? Okay, so the feds don't get the child-specific prevention plans. Nothing is submitted. There is a set of specific data elements that goes to the feds, but the specific family information, including names, social security numbers, etc., does not go. Doesn't have to go to the child welfare agency. And specific child-specific prevention plans don't need to go to the child welfare agency. There are a couple different things that get submitted. There's the required data elements, which we can go to those, but that's a very specific. There needs to be a unique identifier. That's a whole other conversation, but it doesn't need to have the names, addresses, social security numbers, none of that. It has, when do they start receiving prevention services? Are they still receiving it? It's a very basic element that goes for the specific data reporting. Then there's also the data that gets submitted for claiming. And that's just about what EBPs were provided, the cost that's associated with each of those. And then there's also the administrative costs that go on there. It's called the CB 496 Part 3. Nobody wants to hear about that, but it's a specific form that specifically populates the data that's used to justify the claim for federal reimbursement, but not the actual family information or the child-specific prevention plan.
Okay,
Did that answer that
very
question?
helpful. Yes, thank you very much.
Should I go to this next question about mandatory reporting, or should I shift to the opt-in? What would y'all prefer?
I think, yeah, Jay's asked this a couple of times, so let's definitely touch on it.
So how about states that are looking at rethinking the concept? This is going to be a good one. With the New York City warm line might be a good illustrative example to get at this intersection, right? Because there's efforts to reshape mandatory reporting. We're seeing a number of jurisdictions, including New York City, which I'll talk about in a few minutes, kind of trying to shift this concept from mandatory reporting to mandatory supporting. And so we want to be aligning, what is the guidance, and information that we're giving to our mandated reporters about what is the best place to refer families that they think either, have a abuse and neglect concern and might go the more traditional path, or if there is more of a family in need of services and want them to get something, what's the right way to do that? So the information that goes to mandated reporters, then having the infrastructure, whether it's warm lines that we're talking about or community pathways or some combination therein, that there actually is a place to catch and work with families. And
Yeah,
then
Krista,
go ahead.
I think we would love more of that. So this initiative is 1000% upstream in that it is like, hey, mandated reporters, before you ever even contact DCF, we want you to have all of these other alternatives to be thinking about. And the warm line, I think we would love to understand more of like what that looks like and if there's anything else in that part of the stream, which is like the very, very top of the stream.
Okay. Well, so then why don't we put a pin in this and let me do the opt-in and then we'll go to warm lines. And then I
Great.
think some of the stuff will come into play.
Great. Okay.
Is that cool? All right. I'm going to go back to sharing some slides. All right. Are we good? Can you see it?
They're back up. Yep.
Okay. So we have the Opportunities for Prevention and Transformation Initiative, or opt-in, as it's called. Opt-in is primarily sponsored by the Doris Duke Foundation. Excuse me. But South Carolina, one of the 4 participating jurisdictions, is also supported by the Duke Endowment. The 4 participating jurisdictions, and you'll notice repeats, right, with the community pathway conversation, are Washington, D.C., Oregon, Kentucky, and South Carolina. All jurisdictions that have been investing a lot of effort in building out more robust prevention continua through many, many different mechanisms. Other partners in opt-in are Chapin Hall. Not me, but Chapin Hall, colleagues of mine are conducting the formative evaluation. And we've got Foster America, Government Performance Lab, and Think of Us that are all contributing around governance and infrastructure, implementation support, lived expert engagement, and otherwise trying to surround these sites with a cadre of technical assistants to help design and implement their opt-in pathways. So opt-in focuses on families that are screened out at the hotline. So if we went all the way back to that initial visual at the top, we have more than half of calls are getting screened out. We know that there's sometimes not a whole lot of difference between families that are screened out and those that are screened in, and that families that are screened out, if they don't get services and supports, have a high likelihood of coming back to child welfare and getting screened in and progressing further, more deeply into the child welfare system. So opt-in by design is focusing on families that get screened out at the hotline. There is a fundamental principle of co-design. So going back to that question around, man, what if families don't want to do this? Really trying to design what these service pathways are going to look like in partnership with lived experts, community leaders, and intergovernmental partners. And while each site's operationalization looks slightly different, and is based on their needs and state context, all 4 opt-in sites have 4 core service components of access, so identifying, and identifying families, engagement, building their relationship and understanding what's going on, what they need, building that relationship, understanding what they need, and then getting them connected and referred to the right types of services and supports, and then support itself, making sure they're actually getting the resources, the programs, the flexible funds, whatever it is that they need. So the service model is designed around these 4 core elements of access, engagement, navigation, and support. Every site has its own business process, but this is really the core of it, that some variation of this is in play in each of these sites. So a call comes into the CPS hotline. It's decided whether it's screened in or screened out. If it's screened in, it gets its normal CPS response. If it's screened out, there is a mechanism within intake to determine whether or not the family meets the opt-in criteria and their focus population, and I'll go into that in a minute. Then that opt-in eligible family is referred to a resource hub where the staff that's going to work with them. That's the access part. The resource hub navigator reaches out to engage the family and start to build that relationship. Then we go into that navigation space where the navigator is working in partnership with the family to figure out what do you need, what's going to address, the circumstances or concerns or the instability that's placing you at risk of child welfare system involvement. They work together with the family to identify short and long-term supports. Flexible funding is a big part of the service model. So you get connected to flexible funds if the family needs it, and then get connected to what other types of longer term services and supports the family may need. And then you get to support where they get the flexible funds and anything else that they may need. What this looks like varies depending on the jurisdiction, but this is the essential service model. And while much of this is happening right now outside of Title IV-E, one of the overarching goals or hopes or guiding principles for opt-in and for Doris Duke was hopefully that states would be able to tap into Title IV-E for the infrastructure here to help have a sustainable funding source. Each site is focusing on different target populations or the focus populations. So not every family that gets screened out is opt-in eligible. DC and Kentucky are focusing on younger kids in 12 specific counties in Kentucky. Oregon and South Carolina also at this phase have a geographic focus targeting very specific geographic areas where they see a lot of families coming into child welfare, and you can see where they're focused. Where are they? We're still pretty early in implementation. In 24 and 25, there's a lot of exploration, installation into 26. Right now, these jurisdictions are at initial implementation and working to get these service pathways in place with the hopes that will be more implemented in the years to come. All sites have figured out their focus population, which I shared with you a few minutes ago, and do have a process for identifying and referring families. Every site has begun their outreach to families, and they're primarily using phone call and text to reach them. That seems to be the communication mechanism that's working thus far. They figured out their processes for identifying and meeting family needs, including flexible funds. It's in the process of refinement, but some of those flexible funds are getting out the door and into families' hands. And everybody from the beginning has this really strong advisory group established that's playing an increasing role in shaping implementation. Focusing a little bit on the flexible funds criteria, probably no stranger to anybody here. Poverty-related stressors are, a very common driver of families to child welfare systems. Trying to figure out how to provide economic and concrete supports and address poverty-related stressors is a focus that we hear a lot from families, from communities, from advocates, and we at Chapin Hall have done a lot of work around this particular area, sharing this here that every one of these sites has a flexible fund component. And this slide just showcases what that is and some of the specific criteria. Let me pause there. That was a quick and dirty opt-in overview. Let me pause for some questions.
I think keep going because I think still even opt-in is too far downstream for us. So let's go to the warm lines.
Warm lines. Okay. And so full disclaimer, these next slides are not mine. I stole them. We have at the July 25 Community Pathway convening, we had a number of jurisdictions, and I'm repurposing some of the materials that were shared in that convening, focusing specifically on DC and New York City. So DC has a 211 warm line. Who can call their 211 warm line? Anybody, can come from the family or individual can call, a community supporter can call, notice the change from community supporter to mandated reporter, but a community supporter can call the warm line, or they can be directed there if screened out at the hotline. They call into 211. There's a triage assessment there, depending on what's going on. If it is really more of a CPS situation, it gets redirected. If it's a 911 emergency or a 311 situation, the call can be redirected. But if it's not, it makes sense for the warm line. Then there is an assessment to determine if there's some kind of complex need. If there is, the family is redirected to those community collaboratives to receive support and services there. And if there is not, then there's a more of an information and referral to what, whatever community supports or services the family may need. There's a warm line call center. So there's the continued phone support, and it's a closed loop, so we know where, so that's, it's a closed loop system. So if families, call in or they're referred to the warm line, we know what happens. If case management is needed, they do receive that collaborative case management. This is all happening outside of the child welfare system. We know if they receive those services, get connected to services, that's all tracked. And they've got a mechanism for tracking family satisfaction. Those referrals are accepted within 1 business day, trying to figure out what they need, getting them connected, getting them dispatched from where in-person support can take up to 2 weeks. And then you figure out whether it's a long-term situation where they need some complex case management, from the collaboratives, or if it's a more short-term need. New York has set up their own prevention services support line. Many of you may be familiar that New York City has a pretty robust prevention services continuum. They got over 45 contracted providers, over 130 prevention programs. They're serving upwards of 30,000 kids and 50,000 families annually. So there's a really strong infrastructure that this prevention service line is tapping into. Back to that conversation that we were having before, there's been a lot of work both within New York City and at the state level to transform their mandatory reporting system, to shift away from when in doubt, call the SCR or the State Central Registry, to more of this motto of you can support a family without having to report a family. And then subsequently also then building up the preventive services where there is a place that families can be referred to. And there is a very cross-system effort to make this shift a reality, working across public systems, working with private and community partners to really try to strengthen not only the network of prevention services, but all the mechanisms by which families can get to them without having to go through a formal child welfare system process. The ACS support line on this pyramid isn't meant to support, folks that are at that deeper end of the continuum and going into the CPS system. But starting at the top of where the division of prevention services sits, through maybe more intensive prevention models around therapeutic services and treatment, to getting more into family support and still receiving some case management, and to more community level resources through family enrichment centers and community partnerships, or even more informal community resources. So the prevention services support line can get families connected to something as intensive as more of an evidence-based clinical treatment model, down through more informal community supports, depending on the level of need presented by the family. What are we talking about when we think about those types of preventive services? If you're in that family support section, we're talking about case management, resource navigation, parenting skills, concrete needs. There can be in-home visits there, and the length of services is somewhere between 9 and 12 months. We're talking about families that have needs more in that therapeutic, and treatment domain. That's addressing issues like around family conflict and violence, child and youth behavioral challenges, trauma, mental health issues, substance use, where there's higher clinical level of needs. And families can get connected to services for generally 4 to 12 months. And they can also be receiving some assessments and in-home support from their prevention service partners. How do you get there? It's a different number. Like you call the prevention support line, that 212 number, and then they're there to take that call, understand the assessment, and facilitate that first connection to the prevention provider, or help them get the information that they need to do that. And they will stay involved until the family is successfully connected to the prevention services. So they're going to stay involved and still be available until the family gets where they need. It's not just a one and done phone call. And I think I gave you a lot of information today, but I think this slide is really getting at what you guys are really hoping to accomplish. Actually decreasing the number of reports to the State Central Registry. And with the advent of New York City's warm line, and this is looking at data from 2023, the first 24 weeks of 2023 to the first 4 weeks of 2025, they are starting to see in some spaces a reduction in calls, down 18% in 2025 of the three sectors that ACS is engaging in health and in schools and in social services compared to 2023. And especially notable that the schools are reporting fewer families, because as we know, teachers are most common mandated report sources, and really trying to educate our education partners and demonstrate that there's another mechanism to get family support. They are starting to see that bear out in their data. So let me stop there. You'll get these slides, but I'll just let you know there's a whole lot of stuff here at the end to go much more deeply into any of the stuff that we talked about. But let me get the slides done so I can see your faces, and let's talk about some of this stuff. I know I talked super fast and threw a lot at you, so I can unpack anything you want me to. Have I lost everyone?
No, I think you're good. We're sorry. So Krista, thank you, first of all, for doing this and giving us a good summary on all of the different things. We've got a number of people here that are part of the different working groups that we have happening. A lot of the conversations that we're having are, what are those alternative pathways that the teachers, the first responders, that they can access so that they're not picking up the phone and calling the child welfare hotline and making a report. And so we have policy conversations happening. We have conversations around the workforce, like what's the different training that needs to have, what's the programming that needs to have. So we have another shoot off around warm line possibility stuff, and training, and then community engagement around that. I was noticing in your numbers that the numbers aren't going down in New York with neighbors reporting. And so what is just like we've talked about, like what's the broad community knowledge around this need to happen. And so just to give you a little bit of flavor of like how we're thinking about this in Massachusetts, and where we're hoping to go, and really have it so that families don't have to have any kind of engagement with the system to be able to get services. It's really become like a de facto human services system for us here in Massachusetts.
Glad that you raised that. I was in a unrelated but kind of happenstance meeting earlier this week, and I was with the former DC child welfare director. And we were talking about just this issue about about communities continuing to call despite a lot of efforts to redirect and build. And we went into this really deep conversation about how important it is to have this continuous two-way dialogue with communities and partners as we're figuring this out. Like, okay, so we've done A, B, and C. Clearly, their folks are still worried about something. What's at the heart of that worry? What is it about these alternative mechanisms that isn't getting at it, enough where people feel comfortable engaging in some of these alternative mechanisms? And the strength the strategy, really going back to that co-design and lived expert engagement and community engagement, is to have it not only at the beginning of the design process, but to continue to have that two-way communication mechanism, and to be testing those ideas throughout your implementation process. If you're not seeing neighbors change, why? What are they worried about? What are they worried about that these new things are not getting at? What is that? How do we get underneath that and continue to explore what might be an alternative service mechanism that's not, sending folks right back to CPS that may not have a safety concern that warrants that kind of an engagement or intervention.
Okay. I'd love to hear, I think these are the conversations we're having, all of the folks that are online, and any other things that are coming up or having you think about like our culture in Massachusetts, how we do things here in Mass, that kind of raise questions, thoughts, doubts?
I
I think
have
there's
I
lots
think
of
one
doubts.
thing I wanted to elevate was just something you had brought up earlier, Jen, about home visiting. So a lot of the Title IV evidence-based programs that sit in the clearinghouse really live right now in different places and are funded through different things, through
Mhm.
McVie, through state funds, and they're housed not in one specific neat spot, right? And
Mhm.
so, Krista, if you could talk a little bit about how to work across agencies to kind of scale some of these programs, but also start claiming 4E for them. If you can think of an example where like the program was born, already developed, fleshed out, and then FFPSA came along
Yeah.
and we've struggled to integrate it into the child welfare 4E funding stream, but like it's very much present and robust within our community
Yeah.
here, right?
No, it's good. I think the home visiting is such a great example because I think it taps into some of the concerns that I'm going to be picking up from y'all. Like, really, we don't want to be involved with child welfare. We want to reach them earlier. We don't want those types of connections because there's a lot of, rational fear about having having these partnerships be delivered in concert with the Title IV agency. That has been a major exploration in all these jurisdictions that are building community pathways through home visiting. I'm going to get to your actual question, but I feel like I want to stay in this spot for, for a second, because I feel like trying to build, do that trust building, working with community providers that are like, hey, we're not here to be child welfare workers. We're here to provide these supports, using these home visiting models, and being able to work through in partnership with them. What would it take to have a partnership with a child welfare agency that they can trust, to have a mechanism for service delivery and a data sharing, understanding that both meets the paradigm of home visiting and their ethos, but also, kind of meets the requirements. And that's why I lifted up a couple of those examples to show that states have worked through this and have sat down with their home visiting partners to figure out how to make this work. Because going back to your real question, yeah, we've got other funding mechanisms for McVie, but in many cases, the funding doesn't reach the full extent of families that are eligible for or would benefit from home visiting. And
Mhm.
so it only goes so far. 4E, with all of its warts, presents an opportunity to extend home visiting to more families that would otherwise get it. And you start trying to understand who are the families that are in your target population and start having some data conversations. Who are you serving? Who might you also serve, even if you had resources to get there? Is there a way that we can bring these mechanisms together to extend the service delivery platform? And I think and that has been a way to, try to strengthen those connections and have a kind of a data-driven underpinning, to building out the partnerships. The concrete stuff has been relatively straightforward. Like, many of the home visiting models have their own like home visiting service plan. That is then the child specific prevention plan. It's not the new, you're not doing anything else. That existing mechanism then serves as the thing that, that meets the federal requirement. Their existing mechanisms for engaging with families meet the ongoing risk and safety requirements and look for ways to kind of seamlessly integrate things in ways that don't feel like they're more work or building on existing infrastructure, and then create the mechanism to reach more families that otherwise would be able to benefit from the service.
Mhm. We have a couple of questions in the chat. So Delrose had a question around insights and best practices about how interventions were socialized with practitioners.
Can you say more about that? Because aren't the interventions being administered by the practitioners? I need just a little few more words with the question. What does that mean?
So I'm trying to understand, how states got buy-in from the folks who were, for instance, supposed to access these warm lines, right? How were states working to make sure that they were partnering with the folks who needed to access these systems or interventions? What were they doing to be able to let the community know this was available, practitioners know this was available? How did they socialize it?
Okay, great question, and thank you for giving me a little bit more context. Um, that looks different based on different jurisdictions. Connecticut is the first state that comes to mind for me, being close to y'all. When they were developing their Family First Prevention Plan. They brought everybody to the table. I mean, I'd have to look it up, but how many thousands of people through continuous mechanisms, through an existing infrastructure, through community outreach, through town halls, in different mechanisms, virtually in person, to reach, all the folks that would be helpful to have them bought into, or, actually, critically, function as executors of the prevention plan. And so I think thinking about it through what are the outreach mechanisms that work for any jurisdiction? Is there a formal kind of governance structure that has a steering committee and advisory groups and taps into, parent advocates, community advocates, all the people that should be at the table? Is there that then manage that alongside opportunities like town halls and other community events where you can get to more people, then also having mechanisms where people, drop boxes or other elements where people can, raise questions or show up, and also having office hours or other elements. Like there's so many ways you can do it. And some states have been super intentional about creating not only one mechanism, but long-standing committees, infrastructures, ad hoc events, and other really, really purposeful mechanisms to try to reach out to people. But I think the important thing is it's not a one and done. You can't do it one time and think you're going to get there, but to have it be an institutionalized, ongoing feedback loop, not only through design, but through implementation. So we can be checking in with folks of, is it working? Is it meeting the needs? Is it not? But it's absolutely something that's critical to pay attention to.
And we are at time, so I just want to give Jen a second. I'm going to turn it over to you, Jen, to close us out and wrap us up. She was not here at the beginning.
You're on mute, Jen.
Yes, I am. Sorry. And sorry I missed everybody at the beginning. I wanted to say a couple of things. So June and Jane, who are there on Zoom, we'll get some of the data and see what is out there, and we'll make sure that we get that out to the group to be able to answer that question, because I'm also curious about that. Like, what are we learning, what families are saying, what's helpful. And I want to thank you for Krista and Christine and Dimple for being here with us and joining us on this journey here in Massachusetts, as we are really looking to fully shift our ecosystem here in Massachusetts and how we're engaging with our families and preventing the full engagement of child welfare as much as we can. And so we have a lot of committed people in this space with us. And so just we're continuing to learn with one another across nationally to know, like, what are other states doing and what are lessons we want to get from them of maybe things that they tripped over, and so then we don't have to, and just bring in other ideas that maybe we haven't even thought of here. Yeah. So if you have not signed up for our May 28th convening, please make sure you do. We are, Liz just dropped it into the chat. And so it's our twice a year coming together. Where are we? Our working groups will be able to be there. It will look significantly different than December. We have built a whole lived expertise working group and have done a lot of work in the last few months in really shifting who's at the table and how decisions are being made, and how the agendas are even being built. So excited to see many of you there. Please sign up. And again, thank you. Thanks to Casey and Casey Family Programs and Chapin Hall, and love having you all as part of this. So have a good day, everyone.
Thank you.
Thank you.